morning, good afternoon, wherever you're watching this. This is Anita Finley with the Zoomer Times TV, brought to you by Boomer Times Magazine. And we have a very important information interview today. We, of course, have this great Cynthia Meacham who knows so much about Medicare. And so many people are so confused, Cynthia. And that's why I love to have you on our show. So, you know, people who are really looking to get the very best for themselves. And there are so many choices, aren't there?
There are so many choices, Anita, and that's what makes it great, is that I represent both sides, the Medicare Advantage, the Medicare Supplement side, and that way I can thoroughly help a client see what's the best option for them, because as you know, Anita, one plan doesn't work well for the next person. So I gotta kind of see what everyone's needs are. And then I'm able to do that unbiased, like I said, and because it wouldn't be fair if I just represented one of the sides and just was able to represent that. I really feel like I need to do both. And so that way the client can thoroughly know all of their options and it's not confusing. So when they see those commercials, they say, oh, Cynthia already explained that. I already know. Right.
So why don't you write this phone number down, folks who are watching this, because you're going to want this after you hear Cynthia for a while here. It's 954-802-0738. 954-802-0738. And this is really senior services, and it's North America, Senior Services North America. It's a very important company. They've been around for quite a while, and they do have a lot of answers. And the reason we love it is because we have a spokesperson. We have someone that you can call, and she's going to be there to answer your questions. Not like you get a phone number, you get on email, and then you don't even know who you're talking to, right, Cynthia?
That is 100% correct. You call me directly, and most of the time I'm always here to answer my phone and help anybody with anything.
So let's talk about what are the questions generally. What is the biggest question that someone calls you and asks you?
Well, a lot of the times they want to know what is the difference between a Medicare supplement and a Medicare Advantage plan. And I kind of break it down for them. And that way they can see, is it, do they want to go ahead and pay their Part B, their premium? And a lot of the times, Anita, they have a deductible because they're going with the high. If they go on the Med Sup, they go on a high deductible plan. So they have their premium, that deductible, their Part D that they're paying for, which is usually about $4,000 a year. So then with that, I compare it to the Medicare Advantage plans. And I'm not sure if you're aware, but there's something called a MOOP on these Advantage plans. And for the PPO, so you have a very big network. And what that is it's a maximum out of pocket that client is only going to spend per year. And a lot of times that MOOP is much less than the $4,000 that they're spending, no matter what, no matter if they get sick, no matter if they go in the hospital, doesn't matter. You're paying that $4,000. So there's another option, and I like to go ahead and explain that and write it down for them. And then, like I said, they can make it whatever they choose, but we are completely unbiased. And I like to give everybody their choices, and they always want to know, are their doctors on network? And most of the time, 99% of the time, they are. So,
and sometimes they don't even have a doctor, so it could be any network. It doesn't really matter. It's only when they have a doctor already, right?
Yeah, that's correct. And like most of the time when you're 65, you do have a primary care, a cardiologist, whatnot. And 99% of the time, those doctors are taking these plans. There are 2 times more people on Medicare Advantage now than there are Medicare Supplement. So that speaks for itself. These plans are very comprehensive, and these doctors now had to jump in and get on these networks, or they were missing out too.
Right. So now let's look at a doctor's point of view. They have a choice to which one they want to get on, right? So if they don't have to get on just anything, they can get on the ones that they want.
Absolutely. What you really are when you're buying into these insurance companies is you're buying your network of doctors. So depending on, like we talked about before, HMO, where you're just in Broward, or if you want to have the leisure to go to Miami-Dade and West Palm and wherever else in Florida, you go with the PPO. But these doctors are all accepting, for the most part, these plans. I've never come across a doctor that isn't accepting a plan. Not anymore.
Okay, so so that's one question. What are some of the other questions that they ask?
How are their medicines covered? Is a big one. And because we represent I have the Part Ds, there's so many different Part Ds, as you know, Anita. So what I do is I take all their medicines, I put them into my system, and I see which Part D company is going to cover them at the least, with the least deductible, and they're going to get the most comprehensive plan out of that.
That makes a lot of sense, because I would think that medication is probably even more important than a doctor, right? No?
Sometimes they are, and it's just crazy. Yeah, sometimes people are out, hundreds and hundreds of dollars every month for their medication. So hopefully something changes soon there.
Well, you really are very well informed. How do you get so well informed? Do you go to school for this? How do you learn all that you know?
Every single year we have to get renewed. So every single year with every single company that I work with, I have to go through a training with them, and I have to get relicensed. And then they always have a face-to-face with the regional managers. So then I get to pick their brains too. And that way I know all of these plans inside and out.
I see. Oh, so it is a very comprehensive system.
It is. Yeah.
So now once someone calls you and you give them the information, do they remain a client of yours, or what happens to them?
Well, it depends. I'm not very pushy, so I leave it up to you. Here's what you have, and you can decide what's best for you. Usually the approach is once you're my client, you don't leave me, because you can just directly call me for anything, and that's huge for everybody, because they don't have to call into the 800 numbers and this and that. If I can help you, I do, and that's a huge benefit to the seniors.
Oh, I think that's really important. And my guest, as I told you before, is really very knowledgeable. Cynthia Meacham, she is the local independent agent, and that's for the Senior Services North America. So what I've been asking, because a lot of times they have a phone number, you call and the line is busy, busy, busy. And then they say, well, we'll call you back. Then they call you back, and if you've made a lot of calls, you don't even know who you're talking to.
I know. Sometimes it takes a long time to get into these doctor's offices, and it's called a grievance when that happens. When you call into a doctor's office and they're taking a long time to call you back, that's called a grievance. The Medicare Advantage plans are also rated. They have something called the star rating, okay? And they are rated by the consumer, and then CMS watches them very closely to make sure that they are doing the right thing for the clients. So these plans are also rated by you guys. How long did it take, to make a doctor's appointment? How long did my referral take? How is the network? So that's also another way that they're regulated as well. And the consumer can know based on their star rating, how they're going to be treated per se.
That's great news, because I'm sure you've made phone calls, not to necessarily people in the insurance business, but other people, and you just can't get through, and it's
frustrating.
Yeah, right. Especially people who were trying to get their COVID appointment. That was driving people crazy.
Poor things. It seems like everyone's gotten that kind of ironed out now, but I know in the beginning it was very hard for the seniors to get those appointments.
Okay, so let's go to the supplement part, because I know you said that costs money compared to the HMO. The HMOs, the HMOs don't cost money. The Advantage plans, are they all Advantage now? They're not plain HMOs anymore, right?
They're HMOs and PPOs. So a lot of the times people are choosing the PPO because their network is bigger, and they also are costing them most of the time 0% as well.
I see. So how do they know how much money? Let's say they go with the HMO Advantage. How do they know how much money it's going to cost for every visit?
Oh, it's all broken down. Depending on the company, the copays are very small. A lot of the HMOs, there's zero. Doctors, hospitals, inpatient, therapy, zero. So it makes it easy for them to kind of make that decision based on just that. But yeah, no, there's a breakdown that when we meet, there's a summary of benefits depending on which plan that you choose, and it breaks down exactly what you will pay. Matter of fact, I have a client who just switched off the med sup because he was spending a ton of money. He needed knee surgery. And he just called me the other day because he was thrilled. He said, Cynthia, I just paid $150. I had my knee surgery that covered the surgical center, the doctor, the anesthesiologist, and my therapies. And he is thrilled. So the co-pays are very minimal.
Yeah, see, that's what I was saying, that once they know you, and I can just tell, I've not met you personally, but I've been on the phone with you enough, they're hooked onto you. And so here's just someone just calling you to appreciate what you did to get them in the right company.
Absolutely. Yeah, no, we call each other all the time. I send out birthday cards and I keep my clients very close.
I thought so. I could just tell about you. Okay, so now when someone wants to join, let's say they know that they have a bad hip or they have a bad knee or they have other problems. Is there any prevention from them joining any of them? Are there,
Actually not. What I would do is I would find out their doctor, the orthopedic surgeon that they're going to be seeing, where they want to get their therapy at, and I would make sure that all of those facilities are covered in whichever network, because like I said, I represent all of them, so I can take a deep look into each of them and find out who's going to be covered. And then they'll know when I go to have my hip surgery, what's it going to cost, what surgery is going to, what therapy is going to be, and everything. And a lot of the times it's cheaper than what they would have been paying monthly on their supplement.
So pre-existing conditions do not mean anything?
Nothing, absolutely nothing, covered. And they even have plans for people that are, diabetic or have any kind of heart problems that are specified for them, and their medicines and stuff like that are covered even more thoroughly on those plans.
Huh.
It's a great thing. Yes.
Sounds like it. They've been around now for many years, because I know when it first started, they didn't have all these extra things, and it was a little difficult. And I think I mentioned this once before, that before they had time where you could do it all year. My father was taking one, and then the next one someone called him, convinced him, he took another, then he took another. I mean, he was going after all of them because they all gave away prizes, and it is so much better now that they have a certain period of time that they get a chance to choose, and then that's it, right?
Absolutely. Yes, absolutely. And a lot of the times, I know you see commercials and you're thinking, oh, what freebies are they giving? They're not actually freebies. They are extra benefits that are helping the seniors stay healthier longer, because as you know, that if the seniors are healthier, they're staying out of the hospital, which is better for the insurance company and the client. So these benefits, the dental, I mean, a lot of them cover full dentures, 100%, not a copay, not a discount, at 100%. Because teeth, they're finding out, are kind of the root cause of some of these different, conditions and diseases out there. So dental is so important. I'm actually kind of surprised they don't have it covered on the med sup side, because it should go hand in hand with your health. It shouldn't even be an extra benefit.
Absolutely. I totally agree with you. Mm-hmm. That was really something that I felt was wrong, that they didn't do that. And just the way you explained it is perfect. What about vision and hearing?
Huge. So a lot of the companies will give you X amount of money you take to put towards your contacts, your lenses. All of your preventative is covered. So your eye exam is covered at 100% on there. And then for your hearing, they give you benefits every single year, every 2 years, for new hearing aids, which are not, cheap. So that's a huge benefit to somebody out there who needs those.
And the supplemental plans may not do that.
They don't. There's a few that will give you a discount for vision, but nothing significant like the Medicare Advantage plans are giving.
So the benefits.
I'm sorry. Go ahead.
The benefits for the supplemental are that you can go anywhere, compared to, they're probably limited on the HMOs, are they not?
They are, yes, exactly. On a Medicare supplement, you have the freedom to go anywhere. On an HMO, you're pretty much subject to your county. On a PPO, you have a much bigger network and you have out-of-network benefits. So even if your doctor isn't in network, you still get coverage, which is huge.
So, but PPOs do cost something.
No. Most of them are
PPOs do
zero
not
premium.
cost, pardon me, what?
No, most of them are zero premium down here.
I see. So,
Yes.
do all the companies have both, have the Advantage and the PPO as part of the company?
Not all of them. Some of them just have an HMO, but your bigger companies, you know, do have HMOs and PPOs for the client to choose from, and also Med Sup. So you have all three, depending on which works out best for you and what you're most comfortable with.
So why would someone not want to take a PPO if there's no money down, if it has a lot more benefits than just an Advantage plan?
They most of the time they do go with the PPO because they're not spending anything. They have very small copays when they go get knee surgery, hip surgery. Those copays are smaller than what the monthly premium is for the supplements. That's why 2 times more people are on Medicare Advantage now than they are Medicare Supplement.
Okay, now the man that, you're not going to give us his name, but the man that was so thrilled with just spending 150, was he on a PPO or was he on an Advantage plan?
He's on a PPO Advantage plan. The Advantage plans come in a PPO or an HMO. They're both most of the time costing you zero. On a PPO plan, your copays are going to be a little bit higher because they're giving you more of a network.
I see.
So yeah, so that's how that works on there. But he's thrilled. He's very happy. Like I said, all of his doctors were in network, and he was like, "Oh my gosh, why am I going to pay for this when all of this is covered for me?" So he is just my biggest advocate. He might call me now while I'm talking with you. He calls every day to tell me how he's doing.
I love it, and that's right. I can just see how you do make friends, and people, people are still confused. As much as you make it sound easy, without someone like you to really answer questions, and if you don't know the answer, I know you'll find it. It doesn't work that way. Actually, it's more like if you get someone really good on the phone, then you're okay, Cynthia. But a lot of times, the people you get on the phone, they don't really treat you like you would. You know that.
I know. I talk to them. They're still confused, and I get them unconfused, and then they're client for life.
That's right. I'm sure that's what happens. Do you have a good relationship? It sounds like you do have a good relationship with these companies too, because they know that
I
they
do.
need to be nice to you, because you're the one that's going to explain about them.
Absolutely. And that's the great thing is I have all of their regional sales managers. There's numbers in my phone. So if I'm on an appointment or I'm, over the phone and I can call them directly and get my answer right away. So they are fabulous as well.
What are some of the questions that you have to ask? I'm just curious.
When I first meet with somebody, the most important is, it depends if they're turning 65 or not. Have they already been on a plan? Are they already accustomed to Medicare? Do I have to educate them on the A's, B's, C's, and D's, first? Because a lot of times they get confused on the Part B premium and then, their Medicare. So I like to kind of write everything out and break it down and then find out what's most important: doctors, hospitals, medicines. And then I take it from there and see if I can find a company that covers them all, and then present both the Medicare Advantage, the Medicare Supplement, and then let the client decide.
And aren't there, you started to talk about A, B, C, D, aren't there, I don't understand what they are. They're different.
So Medicare A covers your hospital. Medicare B covers your doctors. And D is your prescription drug coverage. Medicare C is your Advantage plans that combine all of that in one.
Is that it? A, B, C, D?
A, B, C, and D.
Okay,
Yes.
so you can help them. Now, with the medication, so if you're with the Advantage, it's free, or with PPO, is it free? You just go
Yes, for the most part, the Medicare Part D, the prescription drug coverage, are included in these Medicare Advantage plans. So you're getting, like I said, A, B, and D all combined into one for your zero premium, and you're paying small co-pays, if any, when you go see a doctor or go to a facility.
Okay, so if you're having very expensive medication, that's still free?
No, you're going to have to pay for your Part D is not going to cost you anything. Where right now you have a Medicare supplement, so you probably pay in addition for your Part D as well, correct? And then
Yes.
you pay for your medicines.
Yes.
With an Advantage plan, you don't pay for Part D, you just pay for the copays on your medicine.
So there are copays. And
Yes.
so you don't really know
No
what
premium
the copay is.
copays.
Yeah.
Oh, I do. Yeah. Once you give it to me, I'm able to type it in and find out exactly what that copay will be per that medicine. Absolutely.
Yeah. And there are, I've noticed lately where, I guess it was on television, it says, if you go to get your medication, it's very expensive, there's a way that you can get it cheaper, something like Good Reads or something, I forget. There are companies that reduce the prices.
I've heard that before. They're not included on the plans, but I do have clients that swear by GoodRx.
Okay, so then you're aware of that. So so do you think that there, like you said, there are some, all Advantage plans don't have exercise places to go, but so if someone really likes exercise and they don't want to pay to go to to some sort of an exercise club, then you'll tell them which ones come with it, right?
Absolutely, absolutely.
And so they're not for all the HMOs do not have access to that club. It's only certain ones.
Most of them do. Most of them do now. HMOs and the PPOs give you that extra benefit of health, because let's face it, if you're at the gym, you're staying healthy, you're moving your body, and that's keeping you healthier, which is keeping you out of the doctors and the hospitals, which is saving them. So that's why they throw in all these, extra really good well benefits for you. And, the dental, the vision, the hearing, they also have over the counter, which you can go and get over the counter things, Band-Aids, aspirins,
really,
things like that. And depending on the company, depending on how much you get per month, but those are benefits as well. Absolutely.
Well, that's news. That's really something. And is there anything to do with nutrition? Did you say that once before, or did I get that somewhere else?
Yes, that was yes, on the Medicaid, Medicare plans, they actually, one of the companies give out a $50 food card for good, healthy food that you can get, no cigarettes or anything like that, but fruits and vegetables and stuff. Absolutely. Just another way to kind of help out and keep you well.
See, you have a very good philosophy about this. I believe that you understand that the plans it costs somebody money, but you're still there where you say it's to benefit the older adult. That's why these people are in business, and that's what you you profess.
Yes. And I love it. I love to help you guys. I love to help find the right, the most comprehensive, suitable, affordable plan, that works out best for you, whatever that may be. I'm unbiased, and I'm here to help.
Okay, I know that she has a very hot client she's got to get to. This is Cynthia Meacham. Her number to call her is 954-802-0738, and she'll help you choose the right health plan. Cynthia, I know you have to go, and I thank you so much for being with us today.
Thank you for having me, Anita.
Do good stuff. I mean, you must sleep really well at night. I know that you know, just like that man called and told you he's so happy. I'm sure you have a lot of other calls too.
Yes, I do, and I love it.
You're the go-to person, Cynthia.
Anything
okay,
you need,
thank
just
you.
give me a call.
Goodbye. Okay, we will. Thanks a lot. Goodbye, everybody.
Bye-bye.